Artificial intelligence's ability to translate complex medical jargon into plain language represents one of its most straightforward beneficial use cases. Medical language is notoriously impenetrable for laypeople. Test results come back with terminology like serum creatinine elevated or mild leukocytosis without explanation. Consent forms for procedures contain dense technical and legal language. Discharge instructions use medical abbreviations and terms that patients don't understand. AI can take these documents and explain them in accessible language. Your kidney function test shows your kidneys aren't filtering waste quite as efficiently as normal, or your white blood cell count is slightly higher than normal, which often indicates your body is fighting an infection. This demystification has real value. Patients who understand their health information are better equipped to follow treatment plans, ask informed questions, and participate in shared decision-making. Health literacy is strongly associated with better health outcomes. If AI can improve health literacy by making medical information accessible, that's genuinely beneficial. The technology can also adapt explanations to different reading levels, use analogies and metaphors that make complex concepts understandable, and translate medical documents into different languages, expanding access for non-English speakers. However, nuance matters critically in medicine, and this is where translation risks emerge. Small wording shifts can change meaning significantly. Benign and non-malignant technically mean similar things, but carry different implications in context. Chronic versus acute, significant versus severe, concerning versus emergent, these distinctions matter for understanding urgency and prognosis. When AI simplifies language, it may inadvertently lose crucial nuance. A simplified explanation might accurately convey the general concept while missing important caveats that affect decision-making. There's also medical legal risk. If AI-simplified explanations omit important information that was present in the original medical document, and a patient makes decisions based on incomplete understanding, who bears liability? If a consent form explained specific risks in technical language and AI's plain language version omitted some of those risks because it judged them too complex or scary to include in a simplified version, that's a serious problem. The original document exists for legal reasons. It ensures patients were informed of risks before procedures. Simplifying it might make it more comprehensible, but also potentially less legally complete. The solution requires careful design and oversight. AI-generated patient-facing explanations should ideally be certified or co-authored with clinicians who can verify accuracy and completeness. Every simplified explanation should include links back to the original official medical documents and sources, making clear that the AI version is supplementary, not a replacement. There should be explicit disclaimers that simplifications may not capture all nuances and that patients should consult with their healthcare providers about anything unclear or concerning. We might also consider regulatory frameworks where AI medical translation tools must meet certain accuracy and completeness standards, perhaps through certification processes similar to medical devices. The philosophical question is whether perfect accuracy is possible in translation from complex to simple language. Some medical concepts are inherently complex and resist simplification without loss of meaning. Trying to explain immunology or pharmacokinetics in 6th grade reading level language necessarily loses detail. This doesn't mean we shouldn't try to improve accessibility, but it means we need realistic expectations about what's possible and honest acknowledgement of what's lost in translation. Medical language exists in part because precision matters in medicine. Oversimplification can create false confidence in understanding when actual understanding is still incomplete. That said, the status quo where patients receive incomprehensible medical information is clearly unacceptable. AI offers tools to improve this situation if implemented thoughtfully with appropriate safeguards and recognition of limitations.